Let's get rolling. Good morning, everyone. This is the May meeting of the Whatcom County Incarceration Prevention and Reduction Task Force and the Law and Justice Council. Our land acknowledgement statement kicks us off. Before we begin, we acknowledge that we are gathered on the traditional and unceded territory of the Lummi, Nooksack, Samish, and Semiahmoo people who have cared for and tended the land since time immemorial. Truth and acknowledgement are critical to the building of mutual respect and connection against all barriers of heritage and difference. We begin this effort to acknowledge what has been buried by honoring the truth. We pay respect to their elders, past and present. Please take a moment to consider the many legacies of violence, displacement, migration, and settlement that bring us together here today. And please join us in uncovering such truths at any and all public events. I'm going to call the meeting to order. I'll let you know that my esteemed co-chair, Jack Hovenier, is once again traveling recreationally and won't be able to join us today. So I'll be chairing on my own. And I'm very, very pleased to start off with guest speakers. I think I mentioned recently that our very own Eric Ritchie was named to the statewide Reentry Council, and congratulations, Eric, on that and for the work to come there. Eric put me in touch with the executive director of the statewide Reentry Council, Janelle McFeet, and had a great conversation with Janelle, and she is here along with Chief Penny Sapp, the Chief Corrections Officer from Kitsap County, who works very closely with Janelle in the local corrections area there. Together, they are going to talk to us and hopefully answer some questions that we might have on reentry practices. I think I've distributed, especially Janelle's bio, which is extremely impressive. And so we're glad to have her in that leadership position. We're glad to have the working relationship with Chief Sapp, and we're glad to have you both with us today. Take it away.
Thank you, Stephen. I'm also having some connectivity issues, so I'm gonna share a PowerPoint, but I'm going to stop my video just in hopes that helps. Okay, so give me a moment while I share my screen. And then hopefully, Penny, can you see this?
Yes.
Perfect. Okay. So first off, I just wanted to say thank you for having us today. I want to be honest. Definitely, this is a little bit outside my scope as the executive director for the council. But as Chief Sapp knows, this is something that we both are passionate about. A lot of the time when we talk about reentry, we are not having conversations about what that looks like with jails and what that looks like with tribal jails and what that post-release piece looks like when we're talking about restorative practices. So and so here at the title, we've been, pre and post-release services and actual second chance, the importance of humane and restorative practices. So this is something today. We're not only going to focus on the Kitsap County Jail Reentry Services in pre-release, but also that post-release program in my previous position. So obviously I'm new to this position, but if anyone has heard about the Welcome Home program, that's a program that's rooted in human dignity and now considered best practice. So with that said, I just wanted to start off with introducing myself, and then I'll pass it to Chief to introduce herself. Again, I'm the executive director of the Washington State Statewide Reentry Council, only 4 months into this position. So although I'm new to this position, I am not new to reentry. So I've been working in the field for over 23 years and tribal reentry for the past 12 of those years. And again, definitely want to see, and as we talk later today, we're in the middle of strategic planning, and I would love to have that strategic planning include that jail piece, and start to have conversations about what that looks like and how the council can partner with our jails here in Washington State. So with that, I'll pass it to Chief Sapp to introduce herself.
Good morning, everybody. My name is Chief Penelope Sapp, but please call me Penny. I've worked for the Kitsap County Sheriff's Office Jail for 20 years. I've been the chief for a little over 2 years. And like Janelle touched on earlier, my passion too is reentry. I've been focusing on reentry services for incarcerated individuals 5-6 years ago. And now that I sit in this position, I have some more authority to add and enhance the services that we have in our facility. It has taken time. It's taken a lot of grant time, and I think grant writing time. I think we'll touch base on that later. But the reward on the other end is surpasses my expectations. Seeing members of our community get released from the jail and do well. Is something that corrections officers don't often get to see. We usually see the negative, and we often never see the positive. So with these reentry services and tracking individuals and them writing us letters of success, we reinforce that to the corrections officers that this hard work is making a difference. Thank you.
Thanks, Penny. So I have to include at least 2 slides here with the Reentry Council. So I work for Commerce in the governor's office, but I also am guided by the Reentry Council and the co-chairs there. So the governor established the Reentry Council in 2016 with the goal of improving public safety and outcomes for individuals reentering the community. Some of those duties and responsibilities, but again, I did mention we're in the middle of strategic planning, but is to advise the legislature and the governor on issues relating to reentry and reintegration of people exiting incarceration, review, study, and make policy and funding recommendations on issues directly and indirectly related to reentry and reintegration, and to develop collaborative relationships to improve public safety and outcomes for individuals reentering the community after confinement. Later today, as Penny knows, we are meeting for our strategic planning session. We've been doing a lot of work. I think that's a 3 or 4 hour session. Right now, this is our draft vision, which is, our mission statement from a while back, changing Washington laws, investments, and attitudes to improve reentry outcomes, increase public safety, and end mass incarceration. So how the heck do you do that? So I'm actually going to forward to a slide so I can get Chief to talk a little bit about the importance of reentry services inside the jail, the importance of MOUs, the importance of partnering with other agencies, and also partnering with your local tribes. And I think it is the Lummi Nation and Nooksack that is in Whatcom County, that are your tribal neighbors. And then I'm going to talk a little bit about post-release programming, but we'll go ahead and kick this over to Chief.
So with Kitsap County, we are really blessed to have so many treatment providers in our community that want to come into the jail and help incarcerated individuals. What you see here is a long list of services we provide in the jail, but with that list comes several treatment providers that are coming in and offering those services. Something that Kitsap County has is, and I mentioned earlier, a lot of this relies on grants. I have 2 civilian reentry coordinators who are embedded in the jail. They're KCSO employees, both who go and do outreach to individuals that are in our facility and find the services that they're looking for. Right from the booking, we start monitoring people who, are opioid dependent, so whether it's fentanyl or heroin, and we try to encourage them to get in on one of our MOED programs, which is we offer Suboxone and Vivitrol, and we do bridge methadone because we have a methadone clinic here, because that's like the first step, but that's not the only step. It's the wraparound services. It's the drug and treatment assessments. It's the inpatient, outpatient treatment when they get released. It's housing, it's everything. So that's what the reentry coordinators are doing. But what the jail has done is, like I've said, is we've opened it up and allowed individuals from the community to come in here and provide these services so that the reentry coordinators can help facilitate that, but it's way too much work. It's a partnership and a collaboration. And so what our goal is upon release is to have a treatment plan for the individuals and conduct a warm handoff to any one of these treatment providers. You know, I've something that I was really surprised with, but as we started engaging individuals and doing assessments, we found that a lot of individuals were victims of human sex trafficking, something that just we didn't know until we asked. And so we've had quite a few referrals to Scarlet Road, which is one of our treatment providers. So it's just really sitting down with the individuals, but having that support from the community and allowing them to come into the jail is really beneficial.
All right, thank you. So when we talk about, I just want to move back to, I don't know, 10 years ago, 8 years ago, when I met with Chief Sapp and started to develop a relationship. And I talk about relationships because not just with the individuals that are incarcerated and behind bars that are really needing that type of connection, it's also important to have a relationship with your stakeholders in your community. And so one thing that we decided that was really important was to put on community listening circles, and Chief's been involved in some of these circles as well. And so we would have, and let me start over. If you don't have buy-in from the community and stakeholders, it's really hard to make any movement. And so what we would do is make this more of a humane process. So we would have, you know, Chief Sapp there sitting next to someone who's formerly incarcerated, tribal community members, success coaches, which I'll talk about a little bit later, law enforcement, elected officials. And there's a picture here, and this was pre-COVID, and we would have these conversations where we could get to know each other on a more intimate level. And then be able to ask tougher questions, right? Because if we don't start asking questions, we don't really know where we're supposed to land. And so that was something that we started. And we also provide restorative listening circles. And again, sorry, this is my previous position, but this is something that I helped design and was the strategic planner for. So I go back and forth using present and past. So restorative listening circles. So this is something for individuals coming out of the Kitsap County Jail, the victim of the crime. If the victim's not willing to participate, we will have someone representing the victim, or sometimes they could write a letter. It depends. We'll have success coaches there. Again, the same group: mental health, law enforcement, community. And so we really wanted to flip the script on, and that's why we titled it the Welcome Home Program. So this is a platform for those individuals that have committed the harm to make amends, but also then they now have a circle of support. And so a lot of this, this curriculum is based around circle work and the importance of that. And that's rooted in Native American culture, but this is also can be for non-Native individuals as well, which we explored with Kitsap County Jail. And so I'm going to go ahead and skip 2 more slides. And so we are a relational program. And I think that's really important when you start to design and develop what these plans look like for your jail or for post-release, is human dignity and relational practices first. We reduced our recidivism by 81% by using this type of model. Is it a quick fix and does it have a financial cost? Yes, but the return is what we're looking at, and actually changing those that are really struggling. So the other thing that we do is called the Wheel of Wellness. So we contracted with a tribal elder who sat down with them and had conversations about what does it look like when you're at your best, physically, mentally, spiritually, and emotionally. So this is not typical of just an individual service plan that just spits out, and we tell them, hey, check in with us once a month, go apply at McDonald's, pee in a cup, and we'll talk to you later. This is something that is really taking a huge investment in who that person is, the story and the trauma that they have been through in their lives. Now, I will say this is completed after review of both the substance abuse disorder and mental health assessment, which actually is done and can be done inside the jail as well. So not only do the jail coordinators, reentry coordinators help facilitate that, they also help with the criminogenic risk and needs assessment, which we'll talk about a little bit later. So with any, we titled the Success Coaches. So we know research talks about that peer-to-peer and that lived experience being extremely important. And so with Success Coaches, we have, they were all trained in motivational interviewing, restorative circle practitioner, they're all restorative circle practitioners, trained in trauma-informed care, historical trauma, strengthening families, and cultural classes they put on. They help with any type of barrier to reintegrating. We already talked about the Wheel of Wellness. They all have lived experience, so they're recovery coaches as well. They're trained in mindset development, CBT and DBT skills. And then on top of that, they're picking up that warm handoff from the jail, which Chief is talking about, transporting to appointments, providing UAs. And then what we'll move into right now is that correctional assessment and intervention system.
I'm sorry, I don't know if would you prefer if we hold questions till the end?
Yeah, I think we have a lot of time for Q&A at the end. So if that's okay, that'd be great. Thank you. So it's going to have Chief Sapp talk a little bit about the risk and needs assessment, because I know this is something that measures whether they're low, moderate, or high risk to reoffend. And this is a really important piece to implement into your jail systems. This is used in a lot of progressive jail and prison systems throughout the United States. And so I'll go ahead and pass that to Penny. But this actually, just right off the slide, it produces a customized and comprehensive report and recommendation for case planning, but also identifies general supervision strategies to be used. So with that, I'll pass it.
So yes, thank you, Janelle. This risk and needs assessment, I went through the training, and I wholeheartily support it. There's not very much training in my career I could say I attended and found value in it, but this was one of them. This risk and needs assessment is time consuming. There's a pre-assessment, and then there's a longer version. And this is where you sit down with the individual and you start peeling the layer of the onion, really finding out, going back in time and finding out why this behavior is occurring. And it allows also for the interviewer and the individual being interviewed to build a rapport. And from that risk and needs assessment, you'll develop a case plan where then we know what services they need. And the individual that's incarcerated, there's buy-in for that, because they feel like they've actually had a part in this, where if individuals go to court and they say you need to go to this treatment, well, maybe they don't feel like they need to go to this certain kind of treatment. They want to go to this treatment. This is what the risk and needs assessment does, is it helps develop a plan for what they need post incarceration, so they can succeed. And yes, it takes an hour and a half to do, but it's an hour and a half well spent.
Thank you, Penny. gonna move to the next slide. So one thing that I wanted to end with here today is something that I'm really, I guess my heart is in. So as a Jamestown S'Klallam descendant and someone who's worked for the Port Gamble S'Klallam tribe for, again, last 12 years, we know that research indicates involvement in tribal culture helps reduce recidivism. And so it is very important that we start to build connections with our local tribes. That's something we did with our community listening circles, but it's also for non-natives to go and explore the tribal reservations and get a tour and learn about the culture. And so pre-COVID, something that Chief SAP allowed us to do was bring in these cultural classes, which is really powerful, whether they were beading, a talking circle, making drums, because when you're closer to that, to your culture, you're wanting to really give back. And, an example, canoe journeys really popular over here, coastal, we're right on the coast. This is something that it's very sacred, and you are not using drugs and alcohol during this time, right? And so just getting to know your tribal neighbors and including them in this process. And what does that look like? And I think that's something that Penny and the jail staff really allowed for. Now, this was pre-COVID, so I'm not sure where we're at right now. And maybe you can talk to that. But again, participating in cultural activities, research-wise, makes one less likely to reoffend in their community. And so, talking about that tribal piece and why is it important to include culture in our jail settings. So I can, we have one more slide, but I wanted to pass it to Penny to talk a little bit about that. We actually, the Port Gamble S'Klallam tribe has an MOU, or had an MOU, I think currently as well, with the jail. So we can have these type of relationships, and we just can't forget about a population that's often excluded. We really want to make sure that they are not only included, but just part of this process. So that's it. I'll pass it to Penny.
So yeah, the pandemic threw us for a curve, and everything was going well up until 2020. And then, the pandemic and the jails, we pretty much had to lock everybody out, and they were staying home anyways. But it kind of changed the dynamics of the reentry team. Initially, during the pandemic or before the pandemic, we had a reentry officer and a civilian reentry coordinator. And the officer's job was to bring the individuals that were going to be enrolled in the class, like Janelle talked about, the cultural class, and bring them into what we had was a classroom. And he was the security for the classroom, just to make sure that everybody mind their P's and Q's. But that changed with the pandemic and the staffing levels. I had to change my grant request, and I know she's going to talk, she's actually got that slide up. The reentry coordinators are funded through the 1/10 of 1%. So my 2 civilian reentry coordinators are now funded under that. But just this last year, I received funding through the 1/10 for 7 officers to open a pod that's been unopened for 15 years, probably over that. The plan of that is to call it a reentry pod, and that is going to be where the classrooms are going to happen. So the things that Janelle's talking about, the cultural classes, the drug and alcohol treatment classes, mental health classes, are all going to happen in the units, because all those individuals that are going to be housed down there are going to be going through the reentry process, and we're really excited about it. So it's going to look the same, except now it's going to be 4 units in what I call West Pod. But this is, again, all grant funded, which is scary but exciting at the same time, because I don't know if Whatcom has the 1/10 like we do, but our committee that oversees the funds is very supportive and knows that the reentry really does. The treatment starts in the jail, and they've invested and they believe in it so much that they've granted us over $2 million just this last year towards reentry with the promise for 4 more years to keep it going. So I'm really excited about it, but it makes me nervous that it's grant funded, but we keep stats and we show success. And I think in the end, just changing, if honestly, I say if you change one life, then it was worth it, but we're changing more than one life, and it's really exciting.
Penny, can you move into this next slide right here?
Yeah, so obviously the second chance, you could probably talk on that, Janelle, because you
Yes.
applied for that. Those federal grants scare me a little bit, but the 1/10 of 1% is the one that the commissioners pass, where 1/10 of 1% of the sales tax goes into this pot of money for behavioral health services. I recently helped develop the strategic plan, or they redid the strategic plan for the 1/10 mental health, behavior health fund. And one of the things they focused on was medication assisted treatment. And that was great. I was happy that they put that in their strategic plan, but thankfully I get funding through the Healthcare Authority and SAMHSA for our MAT program, MAT, MOED, it's all the same. They where I have a nurse who's on staff full-time in the jail. She actually works for EverHealth, which was formerly known as NAVCare. Peninsula Community Health Services is our community provider. They come in and do the recommendations for the individuals that want to be on the program. And that's all funded under this grant. And then another grant we have is the same day release grant, and that's transportation. Because we often know when somebody gets released, if you say, okay, head to Peninsula, which is just down the street, they're going to, if they go left, they go to Peninsula. If they go right with everybody else that's getting released, then, bad things happen. So we actually transport them to Peninsula for their first appointment to get their prescription for their MOUD, and other things are included in that grant. Like we give them a cell phone because a lot of people don't have phones. So we get them a prepaid phone with a month's time on there, so we can get in contact with them and they can call Peninsula for their appointments. For those individuals that don't have housing, because that's one gap I can't fill on my own, I need help with that. But they lost their tent or their sleeping bag when they were arrested. We supply that with them, and a release bag with hygiene items. We're just trying to find things to help guide them towards success where they don't have barriers. Janelle should probably talk about that reentry simulation that I did that like 4 or 5 years ago. And that was so impactful to me because it helped me understand when somebody gets released from jail, the barriers they face, whether it's getting their ID, whether it's getting their services turned on. It's so easy to give up. And so what we here at the jail are trying to do is lower those barriers so that they don't have to get frustrated because they don't have, their services turned back on. I haven't figured out the ID or the driver's license yet. I'm working on that, but I think that's the change at the higher level. But you can speak now, Janelle.
Well, thanks for that reminder for the reentry simulation. So I know that that's very impactful. I have been through it myself as well. And if that's something that you all could put together, it really shows the barriers. I think this was held, where was it held at? In Bremerton at the Marvin Williams. And, communities everyone is invited to this, right? Because we really want, as I said in the beginning, for the community to get involved and to get buy-in. And if they see how difficult it is, you wait in these lines, you get, whether it's DSHS or driver's license or job, and they just continue to have these barriers. And so it's for people that haven't been through the system that can get a hands-on experience for that. So that would be something to look into as well. And then I just wanted to end with the Second Chance Act funding. So in my previous position, we actually received 3 Second Chance Act funding, federal funding. And as Chief was saying, that sometimes those can be pretty intense, but you should also look into those because they love pilot projects. They love anything that is going to move, or startups, or anything like that. So I would definitely look into those as well. And so I know we are at time, so I will open it up for questions. Again, this is like really brief. This took 8 years for our post-release program, but also working with the jail. So again, this is not a quick fix, but if you're invested in making some serious change in our correctional facilities and how we can reduce recidivism in a humane way, then this, in my opinion, is the route to go. And it's all starts with relationship building from those behind bars to commissioners to chiefs to whatever, and get people to buy into it. To be honest, that's not a lie. So with that, I guess I'm gonna end this PowerPoint and open it up for questions.
Thanks, Janelle, and thank you very much, Chief Sapp. Really appreciated that overview. We are open for questions or discussion. Some of these ideas will look familiar to us from our own planning efforts, and others may open up new areas of exploration. Maya, you were in line already.
Good morning.
And could I ask people to introduce themselves and their relation to this work as they ask their questions?
Good morning, Maya Vanyo. I'm the Chief Deputy at the Public Defender's Office. Thanks for being here. I have a lot of questions, I guess. I'll kind of just tick them off if you don't mind. Is this primarily for felony or misdemeanor defendants?
For the jail, on the jail side, it's for everyone. We offer it to everyone.
So people who are going to an institution as part of their sentence still get the reentry services?
If they're going to prison, I mean, with prison, it's difficult because like we have some individuals that are on our MOUD program that are going to get sentenced to prison time, but it's going to be less than 6 months. So we start them on the program. We engage them in the services. They know that they need to go to Peninsula post-release, but they do have to go to DOC for 6 months or less. But DOC will keep them on their medication while they're there for 6 months or less. If it's a crime that we suspect is going to be over a year, then we don't engage them because we let DOC do that. That's the challenging part, but we try to get everybody.
Yeah, I think it's interesting that you can determine that they're going to be 6 months or less. Like, how do you? I guess it's how do you make that determination pre-trial? And because
a lot of communication.
Communication with who?
With them, with their attorneys.
Who on your end is doing the communication? So like a lawyer is disclosing to a sheriff's deputy what's happening in the case? I guess that's my question.
Yeah, or court paperwork. We have corrections officers that go to court. They know what's coming down the pike, but we work with attorneys too. Like they'll say, if they get in this program, it looks better for their outcome or what have you. I mean, they don't divulge anything that they're not supposed to. I've attended court hearings just recently just to make sure that an individual that we have in the program is going to stay in the program and is going to go for 6 months or less. We have no say so in what happens, but we want to get people enrolled if we can. There's obviously some charges that are easy to say that they're probably going to be doing some time if found guilty. So we try not to get them engaged, especially a medication that they're going to go to DOC and have to withdraw off of. And that's what we're really worried about, is like getting them on something and they're only going to have to go there and withdraw off of it. That makes sense.
Yeah, no, it makes sense.
And one thing really quick that I could add to that is, so the Welcome Home program or programs that you could design like this would go ahead and still keep in contact, because our whole thing is relational, right? So if we know where they're going, we can continue to stay in contact with them, and then if they're released back into Kitsap County, then we can go ahead and bring them into the program. So there's as Chief was saying, lots of communication, so we don't lose them if they are excited about wanting to change, that they just don't get thrown out into the universe and never to be seen again. So our success coaches will, either write to them, send brochures, and try to stay in contact with them. But that's the post-release program.
Right. So who does the risk and needs assessment? Is that the success coaches, and is that done post-conviction or pre-trial?
So, go ahead.
I was going to say, Mary D, our civilian reentry coordinator, has the ability to do that. She's been trained on it. So she does that pre and post adjudicated.
And in terms of the community restorative listening circles, it sounds like that those are happening after someone has completed their sentence. Is there participation like a condition of probation or some supervision, or is it fully voluntary?
Yeah, so it's fully voluntary. But what happened in the last years of this program, we worked with our prosecuting attorney to say they had a first-time offense, that they wrote into the court order that they needed to reach out to the Welcome Home program and at least make contact with, so we could work with them. And so that's something that Chad Enright, the prosecuting attorney, and I worked with to have that piece. But other than that, it's a voluntary program.
Thank you. Other people's comments may raise other questions for me. Thanks.
Eric, go ahead.
Yeah, Penny, can you tell me the average length of pretrial stay in Kitsap? Do you know that?
Well, the average length of stay used to be 17 days, but since the pandemic, it's up to 22, 23 days.
Okay, and does that include all charges? I mean, we have in and out folks that are in and out with DUI, and we've tried to exclude that and figure out numbers of an average stay length.
Yeah, and that we include all of the numbers. So that's the people that are cycling through with, the DUIs that come in, go to court, and then get released. With the pandemic and the slowing down of trials, that's what's driving our numbers up. And what might drive our numbers down now is that we've relaxed all of our intake standards. So we no longer we're booking and holding on everything. So that will probably bring our numbers down, because the individuals that are coming in on misdemeanors will get released faster versus the individuals that we've had in here for almost 3 years that are here on felonies.
Okay, do you have booking restrictions on in Kitsap?
No, nope. We relaxed them about a month ago.
Okay.
They're gone, none. Book and hold.
Great, thank you.
Dan?
Hi, good morning. Dan Hamill, Bellingham City Council and Behavioral Health Committee Co-Chair on the task force, along with Mike Parker, who's on the call with us today as well. Thanks for your presentation this morning. I really appreciate it. My question is regarding your Welcome Home program and kind of the sub-programs, the Wheel of Wellness and such. What impacts did you see with the onset of the fentanyl crisis in your community on those programs, with the success rates and recidivism and such?
Are you talking about the tribal community?
Yes.
So I'm actually leaving on Sunday to attend the fentanyl summit that the governor is putting on, because it is a crisis. This fentanyl business is out of control. So one of the things that, and again, I haven't been in that position for a while. And so we started to see an uptick in fentanyl use and overdose in our tribal communities. And so that's when we really tried to increase our contact and to be able to and make sure that they were getting to their substance abuse disorder counseling sessions, taking care of that mental health piece and making sure, you know, if they couldn't get a ride, then that's another thing that our success coaches would do, would make sure that they were getting to their mental health appointments. But because this is such a crisis right now, I'm not in that position anymore. I don't know what they are developing to combat the fentanyl crisis, but I will know this weekend that I'm a part of that strategic planning team to figure that out. So, but I can definitely get back to you on some more information after this summit this weekend.
Raylene.
Thank you. Raylene King, Blaine Municipal Court Administrator, Legal and Justice Subcommittee Co-Chair. My question is probably not quite as relevant as we are still on jail restrictions here in Whatcom County. But we do occasionally have individuals that are booked and they have to serve time on felonies. We have misdemeanor warrants in other courts, and sometimes those misdemeanor courts don't get served and then the person gets out. Is there a way that you work with those individuals that may have outstanding warrants in other counties and other cities?
If there are others, if there are municipalities within the in Kitsap County, we will work with the courts. Oftentimes what they want to do is they'll book them, but they'll PR them, but they know that they're in custody. So it'll be like an out of custody matter. We don't necessarily work, well, I mean, we have the other jails, if it's outside of Kitsap County, confirm if they want that individual on that warrant. And we work with those jails as far as transporting and, you know, passing on the information. But within Kitsap County, we don't have any intake restrictions, so everyone's booking and holding. But sometimes the municipalities will just do, like I said, out of custody, and then so they're not paying the jail bed days.
And I was just going to piggyback on what Penny was saying, is that, and if they enter into a program like the Welcome Home program, the success coaches help them to work on quashing any of those warrants or trying to figure that out. So
and our attorneys and I didn't mean to interrupt you, but our attorneys here in Kitsap, if someone's really, like the individual I said just went to court for, if they're really serious about the program they're on, this individual had some warrants out of Clallam County. So his attorney worked really hard and did a global resolution. So it brought everything to Kitsap, so it could just wrap into one and he could get it done and move on, because he has established a program here in Kitsap County. He has family, he has a plan. So we're excited about that.
Thank you.
Caleb.
Good morning, Caleb Erickson, Sheriff's Office. I'm one of the corrections lieutenants. I had a question, actually a couple of questions, if you don't mind, about kind of the shape or landscape of Kitsap County. So this is probably for you, Penny. As I'm sitting here thinking about the program that you're using, are there spaces that you've got in your facility that lend themselves to this type of use? So kind of like, how big is your facility? What's your average population potentially? And then like, are there meeting spaces that we saw a picture of your, restorative circle? Where does that take place? And, how do you make that stuff happen?
Well, that picture was not taken in the jail, so we don't have that much space. But Caleb, with the jails, and we have to deal with the physical plant that we've been given, and it can be challenging. Space is always challenging, but Kitsap County has 486 beds, but about 50 of those are the ones that I was mentioning earlier with the pod that's not opened. Our average daily population right now is about 350, but now that we have no intake standards, we know that will creep over 400. I have made some changes, like the reentry. We had an office that we turned into a classroom. It could only fit about 4 or 5 individuals that wanted to engage in the classroom. That's why I like the reentry pod, is just taking a whole pod of 4 different units and making that where the classrooms can be held. and no jail is the same, right? So you have to just work around with what you have and be creative and just think outside of the box. That's what I did. I mean, my sergeants don't have offices anymore because our reentry individuals, you know, the treatment providers that come into the jail actually have those offices. And the sergeants don't care that they don't have an office, and it gives them nowhere to hide. So we just took their offices away. It's just finding space. And sometimes that's hard in a jail. But
I'm going to jump in with one question, and I guess this is mostly for you, Chief Sapp, but Janelle, I'll be interested in whether you have eyes on this at the state level also. Appreciated that you're bringing in a lot of community-based service providers through MOUs and so forth. That's similar to the way we operate as well. We're facing, as I think much of the state is, tremendous workforce issues in terms of recruitment and retention. The service capacity of our providers is not what we really need to adequately provide services. Are you experiencing those things in Kitsap County? How are you addressing them? Do you have plans for ways to deal with workforce issues? And Janelle, is that something that might fall within the scope of some of the statewide reentry council strategic planning?
I think for Kitsap, I mean, there's some of our treatment providers that have had some workforce issues, and we've had to, you know, be flexible. Maybe some of those services have gone away temporarily, but they're starting to re-engage. You know, people that do the drug and alcohol assessments, the turnover is pretty high there. Mental health professionals, I think, is difficult to find everywhere in this country. So there's those challenges as well. As far as the jail, you know, we did suffer some serious workforce issues, especially during the pandemic. It's just finding those ways, those creative ways, like having the 2 civilian reentry coordinators just kind of facilitate scheduling people to come into the jail. And then what they do is the service providers go into the units or go into the pod, and then the officer will pull that person out and interview them in the attorney booth. It's just finding those ways. But yeah, I mean, during the pandemic, there was like nobody working, and we were struggling, and our reentry coordinators were faced with a challenge of trying to find services because there weren't a lot out there. But it's starting to get better. I'm seeing the light at the end of the tunnel, which I'm excited about.
And Janelle, from the statewide level, do you have anything in mind there?
So I will have to say, Stephen, so we're in the right in the middle of the strategic plan, and it's messy, right? But we're identifying some issues, and one of those issues is the mental health piece. And so we do have, in this, as a council, we have the capacity to talk with our senators and our legislative staff and make some asks. And I think that will come out of the strategic plan, is what do we need for the state when it comes to reentry? And right now it's screaming for that mental health capacity piece. We do not have, like Chief was saying, enough mental health professionals to go around. And what does that look like with recruiting? How do we maybe look at alternative ways and think outside the box? And maybe that's with restorative circles, maybe that's peer-to-peer recovery coaching programs, credible messenger, things that are already in place that we can just utilize. But we're having that conversation actually later today. So, but definitely looking at seeing what we can do in regards to that.
Great. Dan?
Yeah, I think this might be a question more for either the executive, Seth Paul-Sadhu, or Sheriff Alpha, or perhaps Caleb. And one of the early slides cited an authority, RCW 43.380, and there was also a mention of a 0.1% sales tax. And I think the question was raised, do we have that here? Are we using that? My understanding is that we have a 0.1% sales tax that we use for the jail. And then we have another sales tax that's being used for to provide mental health or behavioral health services. And then more recently, a couple of years ago, both the city and the county passed another 0.1% sales tax that was for the provision of housing, and up to 40% could be used for behavioral health services. So my question, I guess, to the executive or to the sheriff is the 0.1% sales tax that is currently being applied to the jail facilities. Is there any room for behavioral health or other reentry services within that, or is that pretty much spoken for?
It's pretty much spoken for. Back in 2008, that 0.1% for the jail was diverted to pay for. It was told to the voters it was going to pay for the construction and operation of of the jail work center, and eventually of the construction of a new jail, and help support the staff. But in 2008, the council decided to use those funds to pay for increases in jail costs. So that's one of the primary funding sources, and I could see if Sat Paul wants to provide more information on that. Thank you.
Executive Sidhu?
Yeah. Good morning, everybody. We have a full accounting of this money from 2004 to 2022. We have disseminated that information. It was 60-some million had been collected, and no money was put into the general fund. All the money has been used for the operations of the work center and the deputies' cost, and some jail repairs. And I don't have it in front of me, but I will share again. I believe we did share with the council and with this committee, but I will send it. Oh, Tyler is on. So Tyler, you gonna explain that, please? Thank you.
Yeah, Tyler Schroeder. I may not be able to explain that, but I kind of had a question for clarification. Chief Sapp, in KidSAP, when you say the 1/10, you're referring to the behavioral health 1/10?
That's correct. And I'm glad you asked me, because I wanted to chime in. So
Yeah.
Kitsap County Jail 2 has what we call a jail juvie fund, and that's taxes that come in for the jail and the juvenile detention facility. And that money is allocated only for capital projects. So like our really heavy stuff, like, hey, I'm getting new cameras. Yay, let's all clap for Kitsap County. But the 1/10 that I'm talking about is the 1/10 that's available to all treatment providers in the community. And I have to apply for it just like everybody else does. And I may or may not get it. And it's just because I'm an entity of Kitsap County doesn't mean I'm going to receive it. It's a lot of convincing to the council that oversees that money. But there are a lot of treatment providers in this community that are actually receiving, which was about $7 million, a portion of that $7 million a year. But that's separate. All of the stuff that I've been talking about, I keep mentioning, is grant funded, because we wouldn't be able to do this without the grants that we're receiving. It's, the jail gets a budget. It's really tight. It's really expensive to provide medical care and food and staff to the individuals that are incarcerated, but we want to do more. And that's where you have to get creative and find grants and ways to get that money and hope that it sustains.
So then to build off of that real quick, Councilmember Hamel, in February of this year, the health department in support from the executive brought forward a budget supplemental from the behavioral health fund to increase the jail behavioral health and reentry services for about $310,000. And so that's a similar comparison to how to utilize the behavioral health fund for accomplishing services in our community, like they are in Kitsap County.
Thanks, Tyler. Mike Parker.
Hi, good morning. Mike Parker. I'm co-chair with Dan Hamill of our Behavioral Health Subcommittee, and thank you again for your presentation. I was particularly interested when you talked about some of the challenges you might be able to help with when folks are unhoused and going through your program. And I'm curious, where have you seen your biggest successes with those that are unhoused? You mentioned maybe buying a tent or doing some things to kind of ameliorate what their next step is. Where have you found your best successes, and what would you love to have that you don't have for those unhoused individuals?
I'd love to have low barrier housing. That's what I would love to have, but we don't, Kitsap Mental Health just finished and completed, like, I think it was a 72 unit facility that's low barrier housing for people with behavior health, but that was full before it even opened. We try to find ways to get individuals into housing, whether it's an Oxford house, a inpatient, and then the tent situation, like the example I have. I can't find housing for everybody, but if they are living in a tent, then we help provide that. I know some community members might not be happy about that, but that's what they need. And when they were arrested, they had their items, but now they're getting released and they don't have those items. That goes back to that, barriers and getting frustrated and just going back to the behavior that you were engaged in before you got arrested. So every morning I go into the jail and I help deliver our medication assisted treatment medication. So buprenorphine, I go in there and I talk to our patients about what we can get them to lower their frustration. And so they were the ones who suggested tents, not a 1-person tent, a 2-person tent, because that's something I wouldn't have thought about. It's sleeping bags. And we had an individual that was on our program and he got released and he wanted to stay engaged, but he didn't have a house. So when he got released, he went to Peninsula Community Health Services, which is just right down the street. And he wanted to make sure he could get to his appointments. So he told the staff there that he was going to sleep in the woods just off behind Peninsula. So when they found out about that, they got him a tent, a sleeping bag, and he stayed engaged in those services and now is doing well. He's got a job, he's getting housing. I mean, those are the kind of successes that that inspires me to keep writing these grants, even though it drives me nuts because I have so much on my plate. It's worth it when I'm down there listening to the positive impacts we're making on our community members that are incarcerated. So housing is the big barrier, but I don't know how to overcome that.
Yeah, no, I think we're looking for solutions too. Were any of those 72 units from Kitsap Mental Health, just a follow up, were any of those dedicated reentry, or were they all low barrier and but certainly would serve justice involved individuals?
Yes. Oh,
But
absolutely.
they weren't dedicated beds. Okay.
Right. Absolutely. They were just full as soon before the doors opened.
Sure. Thank you for sharing.
Could I just chime in? I do have to jump off for a 10 o'clock meeting, but I just wanted to say something that we did on our post-release programming is develop a relationship with the Oxford houses where they did set aside reentry beds. So that was something that we worked really closely with our local Oxford housing. We also had there are grants out there for housing and for building, and Port Gamble-Squam Tribe just got a transitional housing facility for both men and women on site on the reservation. So and there's other here in Kitsap County transitional housing as well, but having that relationship with Oxford, and we just kind of made our own little agreement where they would reserve those beds for people. Now it's just like 1 bed for someone coming, just saving a reentry spot. So so it's getting creative, and again, this took years to put together, and we're only touching on like the main pieces. This branches out all over the place, right? So but I did want to say that before I have to jump off soon.
Thank you very much. Thank you very much, Janelle. I hope we'll talk again soon. Sheriff Falfo, you have a question?
Yeah, my hand up feature stopped working and I keep getting kicked off, but I just wanted to add to what Tyler and the executive said. There was an answer response to Council Member Hamill's question. There's
Oh, lost him again. Perry, do you want to start?
I will, and I'll stop if I see Sheriff Alfo again. I
Okay.
just wanted to add to some of the information. By the way, thank you so much, Chief Sapp, and also Ms. McVeet for the information. Really helpful, and also sort of a vector in terms of the reentry services that we're providing
Programs in
here.
the community and within the jail. So there are some funds being used for that purpose now. Thank
Bill,
you.
I'm sorry to say we lost you for most of your comment. You were in and out.
I just wanted to add to what Tyler Schroeder, the executive, said in response to Council Member Hamill's question. There is a separate 1/10 that does substantially pay for a lot of the programs that we have in the jail, as well as those in the community. But I don't think there's any more capacity. I think what the question was in the jail sales tax to pay for additional services than what we're already providing. So thank you.
Great, thank you. Barry, back to you.
You bet. So again, thank you so much. Just always helpful to get a sense of what other communities are doing and so forth. Relative to the behavioral health 1/10 of 1% fund, obviously there's a couple of different funds that are out there. Currently, our 1/10 of 1% fund supports with some blended funding from our BHASO. North Sound Regional ASO uses blended funding to support the mental health and reentry staff that are providing services that were referenced that just expanded by Mr. Schroeder. And it also provides some the psychotropic medication that is prescribed for individuals and obviously encouraged, as well as psychiatric services within the jail. We use our 1/10% funding for also recovery court, historically known as drug court, and also housing resources fairly extensively for individuals that have behavioral health needs. There's also multiple contracts from the 1/10 of 1% that are developed with our providers in the community as well. Thankfully, we do have SUD assessments and mental health assessments within the jail as well. And we also use criminal justice treatment account funding. I don't know how familiar you are with that, but it's a different funding from the state to pay for our jail, a portion of our jail MOUD program, as well as giving some funding to recovery court and recovery houses. So just wanted to add that additional piece of sort of how those funds are being used as well.
Thank you, Perry. Okay, Chief Sapp, I want to thank you for your generosity with your time and your experience. This has been really informative. I hope we're able to stay in touch with you and cross-consult as we try to move forward with reentry considerations here locally.
Absolutely. I'm here at your disposal, and Caleb knows how to get a hold of me.
That's great. Yet another value that Caleb contributes to this group.
Thank you, everybody. I got to go to a meeting with my sheriff.
Okay, thank you.
Bye-bye.
So moving on with the agenda, we are at the point of an extended update on the implementation planning for the needs assessment that came out of the SAC, Stakeholder Advisory Committee, for the Council's Justice Project. And Councilmember Buchanan, I think you can start the introduction here.
Yeah, good morning, everybody. That was an inspiring presentation we just had. Stephen, thanks for connecting us with those folks. That was really great. Good morning again. And today we're going to have a very detailed update. As you know, we've had a number of things going on with the Justice Project. Last month, I talked a little bit about the workshops and the upcoming focus groups and survey work that was going to be done. So that took place, that survey work and those focus groups took place in April. And Holly and Marty are going to, from Crossroads Consulting, are going to be giving us a real thorough update on what they learned and what we all learned as a planning team. I do apologize. I have to jump off and go give a similar presentation to the Business and Commerce Advisory Committee this morning. So I'll be leaving after a bit after these folks get started. So without further ado, Holly, Marty, take us away, please.
Thank you. Good morning, everybody. Stephen, just wondering about a time check. How much time do we have for this part?
I think, well, let me flip that back, Marty. How much time would you like?
Well, we were thinking we'd present, I'm just trying to figure out how fast to talk. We had originally thought an hour, but I think that's not possible given the time. So, but we can talk fast or we can talk medium.
Well, I think I think we can give you most of the rest of the time. We could defer the with Mike's forbearance, we could defer the role of the steering committee agenda item, and we could defer committee updates if necessary. And
Okay, well, we'll go along here and we'll see how many questions there are. And we will not belabor our slides. I'm going to do the first part and then Holly will take over. So first is just a little overview of where we are in the planning process. Today, we are here and we hope for your feedback on what we learned in the focus groups and our next iteration of the implementation plan projects. Then next week, we have a presentation to council on Tuesday and the town hall, which is on Wednesday at 6 p.m. And we certainly hope that as many of you as possible will be able to attend online or in person for that town hall. We'll be presenting potential proposed projects and just hearing public input. We'll then incorporate that and that feedback from you today and that town hall and the council meeting, and we'll get another one of our famous polls. We'll then work on incorporating the poll feedback and draft the entire implementation plan. That will include parts that we've talked about before about potential funding sources, where funding's available, and who is going to be the lead on the different action projects. And that will go to you. That will go to council for review. And then we are aiming to have the final plan done by the end of June and going to council. So today, I'm going to do the quick recap of focus group and survey results for you. I hope everybody had a chance to look at the information we sent out last week, and then Jill sent these slides earlier today. So you have both of those. And we're going to ask for your feedback on these proposed changes to the potential implementation plan projects and ask you about any how we can ensure that the final implementation plan projects are implemented successfully. So diving into the recap here. I first just want to say we put a disclaimer on the results, which is that I won't read this whole thing to you, but that we used a self-selected non-random sample. The focus groups are qualitative research, and with that, we are interpreting the results. And so the analysis that we present here is our interpretation of people's viewpoints, and it's not necessarily objective fact. So diving into what the focus groups were about, I'm going to summarize focus group and surveys here. So we did run 7 focus groups, and one was on Zoom, and these were 90-minute sessions. We also asked all of those people to fill out a survey, and they did that before the focus group. So before they really had any discussion about the questions that we were, but before they had discussion about the potential implementation plan projects. That was the focus of the survey, was just having them go through the potential implementation plan projects. We also had more people than we could accommodate in the focus groups, and we asked 14 of these to fill out a survey. And we compensated people for filling out surveys and for participating in focus groups. The focus, so this summarizes who did what here. We had 7 groups again, and 2 of these were with 26 people who had lived experiences in the criminal legal system. That was either personal or a family member. Some of these were also people who were providing peer support or working in the system. And so we had a group of 12 and a group of 14 in those 2 groups. Then we did a group at Lummi Nation. We had a BIPOC group, and that group met twice, and a group, Latinx Hispanic group, and then another group that we just called Other. These were mostly service providers or former service providers in the criminal legal system. There was a key informant interview conducted with the tribal police chief and deputy. And so in sum, we had 60 focus group participants and 14 of those people who only did the survey. This is demographic characteristics of the 74 people who we have information from. When we had 46% BIPOC representation and 42% white, and then an additional 21% who were Hispanic or Latinx. And one thing I want to point out on here also is that we did not recruit people based on whether they had been a victim of crime, but we did ask. And 78% of people said yes, and 86% of those said they had been a victim of crime more than one time. We had 44% of our participants who had personally been incarcerated, people, and they were scattered across the groups. And 35% of those spent more than a day in jail. Moving on. The questions that we asked were about which of the potential or proposed projects seem like they would make the biggest difference and why. We asked about the jail location and where other facilities should be located, behavioral health facilities. And we asked about how can we ensure that the systems, facilities, and services really meet the needs of people in your community. And by that, we were talking with each specific community that we, in each focus group, we were asking the Lummi about how can systems, facilities, and services meet Lummi's needs, etc. Now I'll just get into the survey results first and then go into more depth on the focus group results. So we have just a summary here. So there were, on that list, there were 17 potential implementation projects, and they were divvied up into 6 groups. And for every question we asked, how important is it to you to take action on these items in the next 1 to 3 years? Is it very important, somewhat important, not at all important, or don't know? And then we combined, for these percentages here, we've combined very important and important. And highlighted here at the top is the highest scoring, the thing that people felt was most important, and that is ensuring existing supportive housing programs are adequately staffed and equipped to serve people who are involved with the criminal legal system. So housing rises to the top. And then the rest of the items on this, sorry, I just need to make a little adjustment here so I can see. The rest of these items are all behavioral health care facility or services, and they were all rated as 92% by 92% of people as important or very important. I just want to point out that second up from the bottom is a behavioral care facility center that was alternative to a jail. We talked about this as being like kind of in partnership with the jail, co-located, and that got 92% of people saying it was important or very important. And here we're continuing on, and these other items all got between 86 and 91%. People saying that they were important or very important to do in the next 1 to 3 years. And I'm just moving quickly because I know you have this information with the details. This is the last batch here of the 17 items. And again, the percentages are all in the 80s, except for build a safe and humane jail that's right sized, well designed, and affordable to build and operate. And that got 74%. I'm now getting into the focus group findings. And don't worry, I'm going to pause after I get through these and have time for questions right there. So this is some key findings right here for the kinds of information that, or the kinds of impressions we heard, and then information that we're thinking people may need. So we heard that people's impressions of who, we know people's impressions of who are in the jail were really influencing their responses about what actions need to be taken. And their perspective is that people with behavioral health issues fill the jail, and they don't have information, most don't have information about the criminal charges related to incarceration. We also heard that about drug use, a lot about drug use, and the need for prevention, and especially with youth. And we heard concern about the high percentage of people in jail pretrial. None of this, I assume, is surprising. It's a lot that we heard through the conversations with the SAC. We got a lot of echoes through these focus groups of what we've heard before, which is affirming. People see the need for more behavioral health services and facilities of all types. There was a lot of focus on substance use disorder, as I've already said. Also peer support and ongoing case management. And concern that people just keep cycling through the system, those with substance use disorder in particular, cycling through the system without services for long-term recovery. The last 3 bullet points here are all items that were on the list, and we heard confirmation that these were important. Diversion programs, increasing communication and coordination between providers, and addressing behavioral health workforce shortages, which has already come up today in the earlier presentation. In talking about the jail, people acknowledge that the jail is in bad shape. And most believe that a jail replacement should be relatively small. Now, one thing we heard a lot of is this kind of sense that there's a trade-off between behavioral health services and a jail. If we build a jail, we won't have money left, we won't have resources left to build behavioral health services. We attempted to convey a sense of balance, and I think that's a message that is going to need to be repeated often. We're obviously what came through the SAC is we are trying to do it all. We are trying to have a very balanced approach and not a trade-off. When people, as people did perceive that there's a trade-off, their preference was for behavioral health services and facilities. When we talked about the location of facilities, the idea of co-locating as many services and facilities as possible on one site was pretty popular. They like the idea of people being able to move through a continuum of care without having to travel around to different places. The same as with the SAC, there was no consensus on jail location. And again, just a call for additional treatment facilities and more types of facilities. The groups that we were talking with, the BIPOC groups and Latinx group, they questioned the likelihood of meaningful change and how their input would matter. And we discussed that, and we received a lot of enthusiasm for continuing to be involved in this work. We made some really great contacts. Wonderful people participated, and they would like to continue to be informed and involved in the discussions moving forward. And I will also say that they really appreciated being compensated for their time. And the quote at the bottom here, you know, this person just said, a lot of times we are called to these predominantly white spaces to be traumatized for free. We appreciated being paid. So now let's just, let me just take a little moment here before passing to Holly to ask if anybody has any clarifying questions about those results that I whipped through. All right. Holly, I'm going to turn it over to you, and we're going to get into the revised implementation plan projects.
Great. All right, here we go. So based on the conversations we had in the focus groups, we're going to offer for you today what we're thinking about would be good amendments to the list of proposed potential projects. I think I want to qualify and just say that, you know, I think we're all clear that a 1 to 3 timeline is ambitious regardless. You know, these are big system changes, but I think we do have a sense of priorities that have emerged. And as Marty said, because people took the survey before they engaged in the discussion at the focus groups, we got a lot more clarity about what information was needed and how we could combine things or add things. So I've got them coded here. So we're not going to go through the stuff that we've wordsmithed, but the turquoise are things that we're suggesting adding, and the gold items that are highlighted in gold are the things we're suggesting combining. And I'll tell you why. So next slide. Okay, in terms of these are all about increasing access to behavioral health services. All we did with these is just tighten up the language for some of them, but these were very strong, very well affirmed. So I think they're pretty good to go. And let's go to the next one. You guys should all know those. Okay, item number 5. This is, we had this kind of embedded, but like Marty had mentioned about the concerns of the, you know, cycle of reincarceration, which we all know and understand, that what we noticed is people really needed to hear this more clearly and more specifically, so that there would be jail-based and community-based services. We already had named that before, but then to list out some of the things that we needed, including the peer support. You'll see here, case management, peer support, assistance with housing, employment, healthcare, and all these things. I loved that we had that presentation earlier on today, because I think that really reflects what people are looking for, exactly like we need more support in this area, and all this stuff about the warm handoff and the peer support and having those coaches, that completely fit with what people were saying was needed. Item 6 was we're originally in two projects, and now these are combined into one, again, emphasizing that support and just making sure that, you know, it's like if people are released and there's not a place for them to live, they're going to pop right back into the system. So how to figure that out is just clear. If you remember, it was actually top ranked when we did the survey. This is seen as really critical. So 6 is just combining and clarifying. Next one. Yeah. People were really excited to hear that the 23-hour crisis relief center was going to happen. That's what it sounds like, and did feel like it was needed. There were some, I do want to flag, there were some concerns we heard about the Deacon Center for Hope that from just a couple people that they had tried to get like family members into it and had been unsuccessful and then felt stuck. So that might just be something for you all to be aware of. And then I'd say this is one of the biggest recommendations that we have, which is that if you remember, Marty talked about that trade-off. Like in the original list, we had it, the jail and the behavioral care center, but really there was strong support for this concept that we described to people based on the trip to Nashville that many of you took, where you have a place where people can be sorted into either they're going into the jail or they're going into a behavioral care center, or in this case, we've kind of made the language a little more less defined, because we don't know exactly how this is going to play out, but Marty and I are feeling like having those things together would be really helpful for people being able to support the changes to facilities, because it made sense to them that this sort of co-location of these two facilities would work together. And then number 9, it's funny because in the survey results, do you remember we had the one that was about I think it was explore a regional detox center? They rated that high on the survey, but in discussion, it became clear that's not what they really saw as being needed. What they saw as being needed is a lot more facilities that would help, that were here, that were integrated into our system, and that were really accessible. And the distinction too between the fact that there's behavioral care is a big category, but there's folks struggling with mental illness. There's folks struggling with, substance use disorder, and every combination thereof. So really needing to understand how to build the right facilities to have a good array of services. And the other thing that Marty had mentioned was this campus idea, that in the SAC we started with that idea and then kind of it drifted away. They independently kept coming back to that. Like, we didn't prompt that. They were like, we need these things to be closer together, so that there's more seamlessness of the services that people are getting. Okay, next slide. Yep, 10 and 11 were well supported. No changes there, really. The competency restoration services was really hard for people to understand. Like, we would end up spending time in focus groups trying to explain it. And so it's important to keep it. But I think just trying to get a little clear about what it meant. And again, this is one that we combined because we had it in 2 places in the original list. So when they understand it, and we're going to have to figure out good ways to explain it, there's a lot of support for this, but it was a stretch. I'll just flag this. It was a stretch to explain. Next slide. And then this is the last one, and very, very much in alignment with what Marty was just sharing, which is that folks were really game to participate and to help. And their insight was phenomenal. So I think we need, in our plan, we need to be clear and specific about how that's going to happen moving forward, including the BIPOC communities and people with lived experience. They had great ideas. They had really the depth of understanding, actually, of what they knew about resources for folks and what had worked in their experience. I think brought a lot of value to the conversation. So however we work out that number 15, and I think that's the question, is we're not quite sure how, but I think that's something we need to include in our implementation plan. Okay, next slide. So this is the moment where I'm going to ask if there's what do you guys have, any reactions to what we've got so far? Because this is in concept what we would be presenting at the town hall. And so before we move forward, we really want to get your feedback, and as well as if there's anything else that you're feeling right now that is important to change in the implementation. The proposed, we call them proposed or potential, the potential implementation projects. You want to make sure we get on the table now. So how'd you feel about the list that I just laid out for you? And do you have any questions or changes? Anybody?
Let me interject here that besides the upcoming council presentation and the town hall, that will be sort of some of the last stages of input into finalizing a draft of this. The task force has taken on the responsibility of oversight and sort of putting a stamp of approval on this before it goes finally to the council. And if you saw the timeline, this is really our last open-ended chance to comment, unless you want to do it sort of off the record. And then in our June meeting will be when we look at the final draft of the plan and hopefully approve that for submittal to the council. So we're not going to get a whole lot more looks at this than we have right now and what was in the packet before you. So I hope everybody will weigh in with their reactions and you know, there are no bad suggestions. There are no stupid questions. You know, let's hear what you have to say here.
Yeah, Arlene?
I'm amazed by the focus group population, and I don't know if there's ever been that attempt before, but I'm just really glad that happened, and I hope it will set a model for the future, as you're saying, and that we keep this population involved with the decision making. The thing I wanted to comment on is the issue of housing, because it's come up in every bit of report or feedback all along the last several years in our committee meetings and in our, we now see that it's up at the top of the list of significant problems to solve. What bothers me about the way we're addressing housing is that it's in pieces, little bits and pieces. I don't know how else to say it. This program, that program, this program, but what isn't being addressed is building significant size housing that is not temporary. So I think that, you know, the thing they were talking about today was like 72 units or something like that. And then when we asked, you know, what is the most important thing, that, you know, they absolutely said that was crucial, and it is. But I don't see any planning, as even though I hate adding one more giant project to all the things that we are suggesting. The fact is that it is needed. And the people in positions of power in our community, or funding, or foundations, or charities, or religious groups, they need to band together and make plans for some permanent housing for people who have no homes. Yeah, that's basically it.
Yeah, thank you. Thank you, Arlene. And, you know, it's interesting because one of the things that we did, Marty, if you pop back to slide, oh, what slide is it? It's the one with number 6, the existing supportive housing programs. Yeah. One more up, number 6. So Arlene, one thing that was really interesting too was we had, we've removed clarifying if we're talking about transitional or permanent supportive housing. If you look at how this is now phrased. And the reason we did that is because we had a lot of differences of opinion in the focus groups on what was needed. There's a lot of discussion about what length of time, how to really help people stabilize. And anyway, I without going into too much detail, I completely agree. This is a really big issue, and I don't think that this is clear about how to move forward in terms of how do we actually pull this off, and where's the funding going to be for these kinds of services, and what's transitional and what is long term. So I just want to
we have some temporary housing programs, but I don't see plans for permanent housing, and I know that is necessary too.
Yeah, thank you. What else? Yeah, Mike.
I really appreciate that. Thanks for the presentation today. And Arlene, I really appreciated your comment, and Holly, I appreciated your framing and the response. I too want to see that. And I also know that realistically, right, that's a long path to deal with housing for folks that are justice involved. For me, it would be less about like, exactly how many buildings and where they're going to be located, but I would like to see structures, pathways, priorities with existing, like, with our County Housing Advisory Committee, that we, make an official request that they look at reentry housing. I think there might be a couple of steps that are a lot more about coordinating with, other health department staff, that could create a pathway, I guess, for how we might address this, realizing that you can't necessarily put that all out in front of everybody, what all those pieces are, but how would we achieve it? And how are we elevating the needs of this particular population in the overall housing arena for all of our affordable housing? So I would like to see something, if we could, in there, maybe a little bit beyond what I've seen in their proposal, to Arlene's point about structures and process. So thank you for listening.
Yeah, great suggestion. Thank you. Okay, what else? Yeah, go ahead, Perry.
Yes, echoing what Mike had just shared, and it's interesting because, having worked in the Human Services Division that certainly was involved in some housing processes and funding from a number of different sources, but also obviously was involved in the behavioral health services, those two divisions in the Health and Community Services Health Department had divided into the Response Systems Division and the remaining Human Services Division. And it had been echoed in many of the meetings that I had attended just within, again, the health department historically, that it is important, obviously, to have permanent supported housing, but without the expertise of behavioral health providers that are qualified within that setting, as well as continued development and training of our housing case managers, that they were simply ill-equipped to be able to support the individuals and the level of needs that they had that were coming into those housing settings. And so I'm excited to see that piece has really been identified, within work groups, and also within the discussion groups now, because again, I think that the risk is building additional permanent supported housing, and then not being able to, or focused on the behavioral health support component, because without it, I fear what will occur in that. So anyway, just wanting to reiterate that absolute combination and collaboration of work and communication, and I'm glad that it's surfaced. So
Okay, thank you. Yeah, I think that the material that Chief Sapp and Ms. McPhee presented earlier are really, really critical. Like building out the actual system for how people can get the support they need and create that web of community support, really with peers and with allies and what they call them, coaches. That's absolutely, I think, essential. And I don't know how, if we can emphasize more in this plan, but we did hear in the focus groups, like, you can't just build more boxes and expect that to, or so the way somebody put it was, it's just going to be an endless need. Like you'll never fill that gap if you don't work at the level of creating the connectivity with the people, like to get the support. So I think I appreciate your comments there, Perry, because I think it's really on point. Yeah, other thoughts? Okay, so let's go then. If you do have more thoughts after this and you look at the PowerPoint again. Also, I want to give a shout out to Caleb and Tyler for pulling around that. If you looked at the presentation on who is in the jail, because that was super helpful for council. And again, like it became so clear that if you don't know who's in jail, and Heather, I want to shout out to you too, because you've been saying this in the SAC meeting almost since day one. So true. Like knowing who's in the jail really helps people understand what we're dealing with. So we need to just make that more, I think, front and center. And Caleb did an awesome job at the last council meeting. Yeah, so true. Okay, and this is also, Heather pointed this out. She's so good at this planning stuff. Like we have to make sure that this plan actually gets implemented. And that means, it's not, when you have a plan where you have multiple parties involved, it is not always easy to make it clear who's responsible for basically leading and ensuring implementation. So there's, two obvious things here in this question. One is the funding, of course, and then the other is who's involved and how they're going to get organized to success. How we're actually going to ensure that the steps are taken, given we are all busy doing what we already do. So this is an open question for you all today, because this ultimately is our plan. It's your plan. How are we going to make sure that it actually gets implemented? What's it going to take to get that organized? So I know it's a hellacious question. It's a big question for a Monday morning, but I would love to hear any initial bits of wisdom or crazy ideas on how we could pull this off. Yeah, really?
Well, it seems to me that this is the job of the county executive, but he doesn't have to do all the work. He can make himself some committees from these groups of us that have been meeting for so long and have this deeper knowledge. But the leadership, I believe, should come from Sat Paul and possibly the county members.
Thank you. Excellent. Yeah. Do you hear that? Is not Paul still here? Tyler is here. And what role do you think that the Law and Justice Council and the IPRTF should play in the implementation plan?
Well, I think, just as I said, that we need to pluck committee members out of these groups, volunteers and requests. So our work is not done.
Mm-hmm. Yeah, Tyler?
Yeah, I do, Holly, on your question about the work for the task force or the Law and Justice Council, I think there could be an ongoing kind of review of status of the implementation of the projects and the plans, and kind of a continued guidance to county council and the county executive on what items have been accomplished and what steps need to kind of be done to accomplish the the others. So just some thoughts on that.
Thank you. Other thoughts? Yeah, Caleb?
To kind of piggyback on what Tyler's saying, I kind of feel like in projects where I'm asking for something to be done, or I have a list of things that I want accomplished, I often find that the people that I'm asking to do the work will go off into a corner somewhere and do the work and very rarely check back in with me. So I kind of feel like this is the format for those check-ins. So if there's a particular task or an implementation strategy that there are regular check-ins with the Law and Justice Council to make sure that the work that's being done is indeed what's being asked, so that there's an alignment there.
Excellent, thank you. Mike?
Well, this wouldn't qualify Holly as wisdom, but it is maybe just a crazy idea. You know, on the task force, we've talked a lot about data and the importance of getting regular data. And some of us have brought up the idea that maybe a dashboard. And of course, we've usually been talking about who is going through our criminal legal system. But I think you could use the same request or the same idea for tracking something like this ambitious plan, which has it has many different tasks and many functional areas. And so in order to kind of manage that effectively, and whether that's going to be the county executive together with county council and then with some of us, some type of a dashboard that grabs all of those feeds from all those different lanes of work could be really valuable. I would also advocate that in terms of looking pre and post at how well our efforts are working, especially if we're looking at diversion activities, we're going to need to know ourselves, for people operating programs, and for the larger public, how well they're working. And I would just advocate that, you know, that issue is so central in the task force. We see it constantly as being something that we need. And I would advocate that maybe creation of a dashboard with this situation could be really, really useful as a way to ensure that things are making project, as Caleb, you know, if you're feeding data into a dashboard, you're constantly going to get feedback on whether you're making your timeframes or you're missing your timeframes. And you can also track what's happening to the population, right? What are the effects of what you're doing at the same time? So I would just like to elevate that kind of desire, crazy idea, whatever it be, or method for a way to ensure that projects happen.
That is such a good idea, because of course we know we want to do the data dashboard like that. That's been consistent, but actually using it as a system for tracking our plans, Mike, that is such a good idea. Thank you. Arlene.
Yeah, I was just thinking that we're now ramping up the information that's going out to the community, and I'm seeing it more and more. These are sponsored ads, and it's doing what we should have been doing from the very beginning, and I believe it will be effective. It takes a while, but I see from the conversations that go on around it that people are getting more information. So from here forward, we need to continue that, keeping a transparency to the public, to our citizens, about what we're doing, how it's being done, and what is the progress month by month, or whatever, however we want to do that. But yeah, the communication, which has come up in so many different ways in our conversations today, which is communication is connection, right? This keeps us connected and not isolated. People in power who are isolated, the public does not trust.
So true. Yeah, I'm just so happy. I completely agree with you too. Like, we've just needed more communication, I think, throughout this process, and it's just taken a while to figure out how and who. But I just think that what we've got going now with Pyramid, or what the IPRTF does, is really helping, because people, I don't know about the rest of you, but I talk to, people who don't have any idea what's going on. And it's so fascinating to listen to how they understand the situation, and really I think people are interested right now. I think they're curious right now. So if we give them good information, it couldn't be a better time. And so Yeah, I think just keeping on continuing the dialogue, like you're saying, like ongoing. You can't just go, okay, here's some ideas. Like you have to keep cultivating people's understanding, I think, over time. Yeah. Thank you.
Holly, I'm in the interest of a couple of other things on the agenda, I'm gonna wrap us up on this piece for the moment.
Right.
But just encourage anybody to loop back with Holly and Marty. You've seen the timetable, so there's still a little time for further input, both on successful implementation and on additions or proposed changes in the implementation projects. This has been a good discussion. It was a great presentation. And I think this work is moving forward pretty well, and we're getting closer to an endpoint, I think, or an endpoint to the planning process at least. So thank you both for your work. Thank you everybody for participating in the discussion and looking over and thinking about the work. And we'll pick this up next time.
Thank you all.
Mike Parker, you're still on. I'm sorry, I'm gonna bump your hard work and the steering committee's recommendation on change in the role of the steering committee. Jill, would you put this on the June agenda if you could? I'm gonna note we had an intro for scheduled for Barry, also flagging a June agenda item on the issues that were referenced, I think, in Holly's report on the focus groups and surveys, some issues around protocols for drop-off at the Deacon Center for Hope. So I'll just note that you can look forward to further discussion on that, and some work probably Perry is coordinating with that as well. And then, Jill, I want to give you a second on the annual report before we go into public comment.
Thank you, Stephen. Just real quickly, the annual report is in your packets for this meeting. If you'd like to take a quick look at it, it's coming along nicely, I think. It is due June 30th to the council. Major updates are due by the end of this month, the end of May, so we can put finishing touches on early June. Please take a look at it. This is an opportunity for you to have some input. If you have any suggestions or criticisms or any other feedback, I'm anxious to hear it. Please just give me an email. Thanks, everyone.
And please note that in the draft where we have so far, Jill has yellow highlighted certain sections that either need updating or need answers to questions. And don't be shy if you have anything to contribute in those areas. Please contact her directly so that she can move the draft versions on to the next stage. So all that said, Jill, I'll ask for public comment. I'll remind task force members of the request to stick around while we have public comment. I know we have a number of attendees, so Jill?
Yes, thank you. I don't see any attendees in person in the council conference room. We have a number of attendees online. If you would like to speak to the task force, please virtually raise your hand now by selecting the raise hand icon. I do have one hand raised. Bertie Safford, go ahead and speak to the task force.
I'm just unmuting. Can you hear me?
Yes, we can.
This is Bertie Safford. I'm a longtime resident of Ferndale, Washington, and I followed this process. The comment I'd like to make is that I heard today a pretty clear message from those in the focus groups that they wanted very strongly to be involved in the ongoing oversight and implementation. And then in the discussion that we've just ended with, I really didn't hear that aspect discussed about how we could assure the population represented by the focus groups are intimately involved in the oversight of this project. So I would like to just point that out.
Thank you, Dr. Safford.
Thank you. If any other attendees would like to speak to the task force, please virtually raise your hand now. And no additional hands are raised.
Okay. Thank you, everybody, for participating in a pretty rich content meeting and good discussion. Lots of work left on our plate, and so we'll let you get back to your day jobs, and we'll see you next time. Meeting is adjourned.